Good morning, everybody. I am not Amanda Vito, as you can tell. For those of you who don't know me, my name is John Bradley. I am one of the owners of Performance Physical Therapy. Amanda, unfortunately, was coming down with something yesterday which did not get better, and I insisted she stay home and take it easy today, so I'm stepping in. They literally pulled me out of the mothballs to get here this morning to try to give you guys some good information. So I'm gonna sort of follow what Amanda has put together as the program to talk about balance, but I'm going to throw in some anecdotes and supplements from my coming up on 33 years of practice. And I know what you're thinking. He doesn't look that old. But my partner Steve and I started the practice in 1992, and we were actually practicing in the Wilmington area even before that. So I've had a lot of experience taking care of people who have balance problems. And what's that? Let me put that through my wife first. And that's the assumption that you're all here today because you have some issues with balance, or you have someone who you know who's close to you who might have some balance issues, and you want to find out what is available to help you or help the person that you're here for, or you just have some curiosity about this whole concept of balance. And as a PT who's been practicing for over 3 decades, there has never been more interest in balance in popular media than there is now. I mean, there are, newspaper articles and articles online, and you can just spend days researching balance. If you just put balance into Dr. Google, you'll come up with all kinds of interesting and not always accurate information, but there's a lot of interest in balance. And the reason for that is the data keeps getting stronger and stronger, that people with balance problems are a higher risk for falls, and falls, as some of you may know, open up a can of worms. Fractures, other disorders and problems that are associated with falls. So the prevention component of it is huge. Now, just from personal experience, I will tell you a little story here, because most of you in this room are a little bit older than me, I can tell. But I'm going to tell you a little story. When I was in college, my brother, who's a bit older than I am, had already purchased a home. He bought an old house in Newcastle where we all grew up. And when I would come home from college, I would help him renovate this house. And we did everything. We did roofing and siding and put windows in and everything. So I remember, and he and I like to share this story because it's sort of a fun story from our youth. I remember being up on the roof of this house, pretty steep roof, and he and I were walking around like cats. No concerns. I was totally confident moving around the roof. I felt like I had claws in my feet. Do you think today I would ever get up on a roof like that? No way. Why? Because I know I can feel a difference in my body at my age, almost 55, compared to when I was 25. As those decades change, our bodies change. Okay? And, you've heard the expression, well, I'm starting to lose a step or lose half a step. That's not far from the truth. Physiologically, that's pretty accurate when it comes to understanding what happens organically in our bodies as we get older. Balance, and Amanda had put together a really nice little outline of this presentation, which you have in your folders, and I'm going to try to stick to that as closely as I can. Balance is a function of a number of different systems in the body, okay? Our visual system, your eyes, let's start there. Now, I'm not an eye doctor, and I'm not going to stand here and tell you that I can fix eye problems. I can't. But you have to acknowledge that if you're having difficulty with your vision, regardless of any specific eye disorders you might have, or your eyes are just getting a little bit older and maybe your glasses need to be, the prescription's changing, those types of changes will affect your balance. Those types of changes in your eyes will affect things like depth perception. If you're walking along the across a floor, and there's a threshold or there's a grade change. As we age, our eyes don't pick that up as easily. All right, so that's a natural challenge that all of us have as we age. As our eyes change, we don't pick up things that could potentially throw our balance off. So, Amanda at the end had put some tips on how to, begin this process of working on balance. And one of the things she wrote was get your eyes checked, make sure your eyes are healthy. That is absolutely essential. You could be doing everything else right in terms of maintaining and improving your balance, but if you're not taking care of your eyes, you're not going to have a lot of success. That's a huge, huge factor. The other component that she mentions there is called somatosensory. Big word. So basically what that means is the feedback that your body gives you when you're standing and walking. Okay? When I'm standing here, I don't have to think about it. It's automatic. I know I'm not moving. I'm standing still, but I can feel pressure through my feet. I can feel I have an even amount of pressure from the front of my feet to my heels. I'm not too far forward and I'm not too far backward. All right? That system, the nervous system, the parts of our nervous system which control that, typically degrade as we age. All right? Anybody who has a problem called peripheral neuropathy, if you're familiar with that, it's a problem where the nerves, particularly in the feet, don't function well anymore, and we don't get good, accurate data that there's pressure on our toes or there's pressure on our heels. If you don't have that, if your brain's not interpreting that information or not getting it in the first place, that's going to make balance very difficult. Especially when you walk on uneven surfaces, because when we walk on an uneven surface, it's that feedback that our brain gets from the nerves in our feet and our ankles and our legs, whether we're going uphill, downhill, whether there's a little divot that we're going to step in. Our bodies, our muscles should be making real quick changes and adaptations to those uneven surfaces. As we age, the nervous system changes. Okay? The nerves aren't as quick to respond. They don't always relay the information quickly, sometimes not at all. So that's another challenge to our balance as we get older. And the final part of balance is the vestibular system, and by that I mean the inner ear. All right? There's a mechanism inside of our ears on each side that tells us where our body is in space. So think about a carpenter's level. It has the little glass vial in the middle and a bubble. If you tilt the level back and forth, the bubble moves. Okay, it's always trying to orient to the horizontal. That's how these mechanisms in our inner ear work. And I hate saying this because I've already said it probably 15 times, but as we age, I can't say it any different, as we age, that mechanism can get a little off. It gets a little rusty, all right? Changes occur in our inner ear that prevent the leveling system from giving our brain the information that it needs to tell us whether we're this way or this way or this way, all right? So these are all natural processes that occur as we age. Sounds kind of doomy and gloomy, doesn't it? The good news is that you can compensate for these things, and you can actually improve the function of these systems even if you've lost some ground in your balance control, right? A lot of people think, well, I'm not as agile as I used to be. I've lost a step. I guess I'm just getting closer to the other side. That's not true. That's not true. The science says that's not true. You can improve your balance by doing very specific exercises and techniques. And that's what we're going to talk about today, how you can take what you have now. If you have any one or combination of these issues that I just talked about, how you can take that and compensate for it by doing exercises and balance training. I often use the example, if I'm talking to a patient and they're having a balance problem and they're very concerned about whether their balance is going to be changed, or is there a chance it could be made better? I always use this example. You could take a very high-level athlete, let's say a Major League Baseball pitcher, and by the time a pitcher gets to the major leagues, from high school to college, how many pitches have they thrown? 1 million, probably, right? They can do it with their eyes closed, and the ball would probably go right over home plate. They've done it that many times. Now, if we take that pitcher and they stop playing the game for a while, they have a shoulder surgery, which takes them out of commission for a year or two. When they go back to start playing baseball again and start pitching, are they going to be as good as they were before the injury? No. They're going to throw the ball and they'll be terrible. It'll take them months and months to regain the skill they had, but guess what? Through repetition, they get it back. They're relearning movement patterns that were already memorized in their brain. All right? You've heard the expression, use it or lose it. That is probably no truer than when we're talking about balance. Okay? When you stop your activity or reduce your activity, you are reducing the training of your balance system. That's one of the people ask me, well, what is it about aging? And I understand the eyes and the inner ear and all that, but generally, older people have balance problems. Well, generally, as we age, we become less active, for a variety of different reasons, and that's the use it or lose it phenomena. If you're not regularly activating the somatosensory system, if you're not regularly walking and standing and shifting weight, those nerves start to shut down. Your muscles get weaker. They get stiffer, tighter. They're less likely to react if you have to, recover your balance. So by retraining your body in these balance responses, you're no different than that major league pitcher who has to retrain the motion of throwing that baseball. It's the exact same thing. It's the exact same thing, and the science tells us that. So now, I could, those of you who know me know that I could just keep going. I could just keep going. Once you get me warmed up, the mothballs have been pushed aside and John's awake now. So, we're going to have time for questions at the end, but if something really jumps out at you, give me a wave or throw something at me, okay? Now, so we talked a lot about the risk factors for fall: aging, weakness, poor vision, changes in our muscles, the loss of flexibility in our hip, knee, ankle muscles. Home hazards. What's that mean? Well, I was at my uncle's house yesterday. My uncle lives in Wilmington, and he lives by himself, and he's almost 90 years old. And I'm looking at his, I go in there all the time, and I can't turn off my physical therapist personality. I'm always assessing him and watching him and making sure that he's doing okay. And, I'm watching his leg movement and his posture. I'm always, chastising him for not exercising enough. And I've made a habit, I made a habit years ago of looking at his home, because he does live by himself, and trying to identify hazards that he would encounter that might make him lose his balance and fall. Number one hazard: area rugs, right? Area rugs. One of the other things that will tend to occur as we age, when we walk, as we get older, we tend to not pick our legs up as high. We tend to shuffle. Our feet don't clear the ground as much as they did when we were younger. And that can be for a variety of reasons, like we just discussed. You start losing some strength. You start losing some flexibility. If your foot is not clearing the ground, you're more likely to catch it on something. And I can't tell you the number of times that I've had patients that I've seen because they fractured a hip, had to have a hip replacement, broke their ankle, and it was a trip over an area rug. Okay? So I try to encourage people to get rid of them. They're just, I've seen it too many times. So that's one thing. Or at least try to move them so that they're not in a frequent traffic line where you're going to walk through the house. Clutter. Now, my wife is the most organized person I've ever met. I'm not the most organized person I've ever met. And, it's very easy to put things on the floor. You're watching TV, you put a book, or you're reading, you put a book down. I've had so many patients over the years trip over something on the floor, or worse yet, on the steps. The steps for some people are like shelves, right? You put stuff in the sides, thinking you'll have enough room in the middle. You'll put things on the sides of the steps. Not a good idea. I've seen too many disasters with that. So the hazards in your home oftentimes are very commonsensical things, but they're so commonsensical you ignore them, right? Because it's like having a scratch on the wall that's been there for 10 years. After a while, you don't notice it, right? So I want you to, when you go home today, just start to look at, pretend John's right next to you and he's looking at your house. Take a look at things like area rugs, trip hazards, doorways where you might have something on the other side of the doorway that narrows the opening. These are real life practical things that could be fixed pretty quickly. Okay. Nutrition. Does anybody know what? And I'm not gonna. I'm gonna say it's nutrition, but it's part of nutrition. It's part of something else. One of the number one reasons why, when I say older people, I'm going to say people in their 7th, 8th, and 9th decades. One of the number one reasons they're admitted to the hospital outside of trauma. Dehydration, exactly. Dehydration. We as a culture, I think, are chronically dehydrated. I don't think we drink enough water. I hear this all the time from primary care doctors. My wife's a nurse practitioner at Christiana Hospital. When she admits patients into the emergency room and they happen to be older patients, they are almost to a 100%, they're almost always dehydrated. Dehydration will affect a number of the systems in your body that could ultimately adversely affect your balance. Electrolyte levels, your muscles need the proper levels of potassium and sodium and calcium in order to work properly, and being dehydrated throws that off. Dehydration also affects kidney function. It makes people feel unwell. People feel sick when they're dehydrated, and that can make you feel weak and not want to take as big of a step. And so all of these physical symptoms are often related to dehydration. So I can't even begin to tell you the number of patients that I've seen over the years who had a hospital admission for dehydration. It's staggering, it really is, and it's very simple. We just need to be drinking more water. As PTs, as clinicians, we talk all day long, so we're constantly drying out. And you go into any one of our PT offices and you'll see these 1-2 quart water bottles, and we're just drinking all day. I have to stay hydrated. And even though you may not be that active or that talking that much, you need to be hydrated. You really do. Okay. So those are some very practical things that I think are quick fixes. Those are things that you could work on today. As soon as you leave here, you start working on that stuff. Now, what I want to do is I want to talk a little bit about, as a physical therapist, what do we see for someone who has a balance problem? What are the typical signs that make us go, I'm a little worried about them falling? And I'm going to run through the types of observations that I've made over the years watching patients as I evaluate them. And maybe some of this stuff will hit a nerve with you. And it should. I want it to, because I want you to become aware of what some of these risk factors are, not just the ones we've talked about, but begin to look at yourself or the people around you, spouses, family members, friends, who you're concerned about their balance. I said a moment ago that one of the common reasons that people trip and fall is they don't take a high enough step. Okay, it's called, we call it in our field, decreased step height. You're not picking your feet up. And I remember my parents yelling at all 4 of us, pick your feet up, pick your feet. We'd be running through the house and shuffling and so forth. Picking your feet up doesn't mean, walking in an exaggerated fashion like that. Picking your feet up, from our perspective, means getting away from this kind of a walking pattern. Okay, I'm going to walk down the aisle here so you guys can see what I'm doing. Where I'm just barely clearing my feet off of the floor. How many times have you seen people walk like this? It's fairly common. People with balance issues or orthopedic issues, they tend to walk with small steps. They don't pick their feet up off of the ground. Now, let's say I'm coming up on a threshold here. My vision's compromised. I'm not really noticing exactly where that threshold is, and I don't pick my foot up. I begin to catch my foot on that threshold, and I'm going to go forward. Now, it's the luck of the draw whether I'm going to catch myself, depending on how flexible I am, how strong I am, and how quick my reaction time is. But what set me up was the very shallow, low step I took. The reason that a lot of people take that step is that our brain plays a trick on us. Our brain's telling us, don't take a big step. A big step is risky, all right? That's not the case. Mechanically, you are more stable when you take a larger step and you separate your feet farther apart when you walk. Instead of this shuffle where neither foot ever passes the other foot, that's what your body wants you to do. Small steps, don't move too much, right? The fear, the protective mechanism makes you want to walk like this. That's making you more risky for a fall. Think of it this way. If I'm standing like this and my feet are together, and one of you comes up to me and tries to push me over, even though I'm 190 pounds, you're going to have a pretty easy job of pushing me over, okay? Even if you're smaller than I am. If I'm standing like this and you try to push me over, do you think it's going to be harder to push me over? Yes. I've got a much wider base of support, my legs are staggered, and I'm much more stable. The problem is our brain tells us to do the opposite. So one of the techniques that we use in PT is, when we're training somebody to improve their balance, is taking larger steps. And we have a ton of techniques and equipment that we can use to help the person retrain. Remember what I said before about retraining motion? That walking pattern, that proper walking pattern has to be retrained. I can't just tell the person, take a longer step. Okay, see you later. No, We've got to do 1,000 repetitions of 10 different exercises where the person keeps doing that over and over again to reprogram their brain, just like the baseball pitcher, okay? So that's one of the biggest risk factors I see when I physically have a patient in front of me who has a balance problem. They're taking very small steps, okay? Now the other telltale sign, and you can start to look at yourselves or look at other people. People who have a balance problem, they will also have a tendency to walk with a little bit of a waddle. They'll sort of move their legs out to the side, like this. I'm exaggerating. Doesn't always look that obvious. Normal walking, there should be just a very, very tiny space between the feet when we walk, almost like you could have a piece of paper in there, okay? That's normal walking, all right? That keeps the center of gravity over our feet. But the person who feels off balance, they're going to throw their legs out to the side like this, okay? Now, why do you think they're doing that? Stabilizers, right? Okay, the wider I get my legs, nothing's going to happen to me, okay? The problem is that a considerable amount of the person's body weight is from the waist up. And if the person starts doing this, that body mass starts moving back and forth. It's like taking a column of little blocks that a child might play with, and you start moving it back and forth. Eventually, the mass of those upper blocks is going to cause the whole thing to fall over. That's another risk factor for falling that I see with people. When they start doing this side-to-side waddle, it's harder for them to recover their balance if they're going to begin to lose it, because they're already moving to the side. Leaning Tower of Pisa, I call them, okay? So those are the very common observations, and there are many others, but those are the things I tend to see that are fairly universal. Small steps, shuffle steps, the side-to-side waddle, okay? People not picking their legs up. And again, these are all things that can be improved. All of these things can be improved. Now, how would you know I'm going to try to get you into the head of the physical therapist here. How would you know if you have tight muscles, maybe your muscles are a little bit weak, and you are thinking, well, maybe I should do something about this, but I really don't know what's wrong with my body. How would I figure this out? Well, I'll tell you how we figure it out. We go through testing, objective testing that looks at things that predict the risk of falling. Now, Amanda, did a fabulous job here. She said, exercises to help your balance. Let's get up and moving to test your balance. So there are a couple of tests that we do very quickly in the clinic when we're working with somebody with a balance problem. And those of you who've been in our clinics, you may have seen us doing this with other patients. I'll tell the person, I want you to stand on one leg, fold your arms over your chest, and pick the other leg up. Okay? Guess what the standard is? Guess how long, anybody want to guess how long you should be able to do this? 30 seconds, correct. The number of people who can do 30 seconds, tiny. It's a very small number of people. All right? And again, for all these reasons, all these changes that occur as we age and the changes our bodies go through physically make it difficult to do that. That is probably the number one predictor in terms of a correlation in research. That's the number one predictor for a risk of falling, is how long you can stand on one leg. And that's why it's one of the most frequently performed tests. If a person is struggling with that, they are immediately classified as a higher risk for falling. All right. Another test that we often do, and you've probably seen us do this before in the office, is we'll take a chair. And we may have even asked one of you to do this before if you've been with us. We'll tell the person to sit on the chair, and we have a timer, stopwatch. We set it for 30 seconds, and we say go. And we have the person get up and sit back down, get up and sit back down. We count the number of times they get up and down from that chair in 30 seconds. There are standards. Research has been done. There are normal values for how many times you should be able to do that, whether you're male or female, and based on your age. Don't ask me to tell you what they are because they're all over the place. But I'm sure Matt probably knows. I'm sure Brian probably knows in back. But if a person, I'll use an extreme here. If I ask you to do that, and in 30 seconds you can only get up and down 3 or 4 times. That's not good. Why? That's telling me your muscles, particularly your leg, hip, thigh, ankle muscles, don't have the power to propel you up. And that's going to be a problem. If you need those muscles to help you recover balance, if you start to lose your balance, they're probably not going to do a good job of it. All right. There's another test that I'm going to throw in here. Amanda didn't put it down, but this is one of my favorites, where we have a person sitting in a chair. This looks at your ankle flexibility. You sit in a regular chair, and you can do this at home. Your feet are directly underneath of your knees, so your knees are at 90-degree angles, right? You start scooting forward in the chair. Your bottom should be almost off the edge of that chair, but your heels should still be on the floor. Okay? As you scoot forward, if your heels start to lift up, you do not have the appropriate amount of flexibility in your calf muscles and your Achilles tendon to help you quickly recover if you lose your balance, because that initial response to recovering your balance starts down there. And you need to have that elasticity in your ankles and your Achilles tendon, your calf muscles, to be able to make the motion to recover the balance. So, try that at home. Sit down in a regular chair, knees are bent 90 degrees, keep your feet flat, scoot forward. Your bottom should almost be off the edge of that chair, and your heels should still be on the ground. I bet in this room, maybe only 25% of people could do that. It's amazing. I've tested very young athletic people, and they have a hard time with that because people aren't completely and thoroughly stretching their ankles and their calf muscles out. We can show you how to do that. Very, very simple to do. So these are sort of the evaluation. I'm just giving you a snapshot. The types of things as physical therapists and physical therapist assistants, these are the types of things we look at if you're going to come into us. And, you know, we have to test you just like you'd go get tested for some other problem. There's no cookie cutter formula for a balance exercise program. People sometimes will call up the office and say, could you just send me, we've never seen them before. Never heard of them. They just heard of us somehow. Can you guys send me a balance program? I can't really do that because I don't know what your balance problem is. That's like calling the doctor up and saying, hey doc, send me an antibiotic. I have a sinus infection. Well, should it be amoxicillin? Should it be Zithromax? Should it be Keflex? How do you know? The doctor's got to see you, look in your nose and your ears, and figure out what the infection is. That's the same way it is for balance problems. There are no two balance problems that are the same. Now, what I wanted to do here was just demonstrate very quickly, because I want to have time for your questions, some of the techniques that we use to retrain. That should be one of the words that's stuck in your mind today when you leave here, retrain. You can retrain your body. We have all kinds of interesting little props, nothing fancy, and some of this stuff you can, you know, when you work with us in therapy, we always want to have you doing and practicing things that you can do at home. There are a multitude of exercises to retrain these systems that we talked about. This is just a little plastic safety cone. And you may have seen patients doing this in the clinics. I have someone standing in front of that cone and I have them lightly tap the top of the cone back and forth, just like that. Okay? Now, if you don't have a cone, it could be the bottom step of your stairs. Having to shift weight back and forth, let me demonstrate that again. Having to shift weight back and forth teaches your muscles to quickly contract and relax. It also helps to rebuild and retrain that nervous system that gives your brain the information. Where's my weight? Am I on my toes now? Am I on my heels now? It goes very fast. Your brain doesn't take as long to do that. But the more you do that, the faster that response gets. Okay, that's just one example. Is that the appropriate exercise for everybody? No, but it's an example of one of the things that we can do. And it's very, very simple. So this is another tool that we use. It's called the Bosu disc. Basically, it's like one of these big gym balls cut in half and it has a solid plate to it. We might have somebody work on stepping up and down from this cushion. Now this is hard stuff here, okay? This is high level. But no matter how bad your balance may be now, it's going to get better if you work on it. So you see something like this and you think, oh my gosh, there's no way I could do that. Nah, don't ever say there's no way, okay? Because I've taken people who have a hard time walking forward, you know, even with a cane or a walker, and eventually they can do that because they spend a lot of time retraining the right exercises and the right motions. If this isn't the right exercise for you, maybe we do something a little simpler. Maybe we give you a weight or a rubber band and we tell you stand on one leg, let your other leg just rest on the floor, let your other toes rest on the floor, and you work on pulling that weight back and forth. What's this doing? The weight is like someone trying to knock you off balance. And you're teaching the standing leg, the muscles of that standing leg to react to that force. And then you switch legs and do the other side. I could literally spend the next 3 hours going through all kinds of balance exercises. There are just so many options that will help people improve where they are right now. But those are examples of some of the things that we do every day, and they're very easy to replicate at home. Once you get good at them in PT, your therapist would tell you, hey, start practicing this stuff at home. It's very easy to do that at home. All right. Now, Amanda's final advice here that she is speaking through me. I'm channeling Amanda right now. I'm just let you guys know that. You know, you need to take action now. If you think you're having a problem, don't wait. Don't wait. Because guess what? It's not going to get any better. If you think you're having a balance problem and you're not doing anything about it, it's not going to get better on its own. That baseball pitcher is not going to get back to throwing strikes by thinking he wants to throw strikes. You have to physically get up and do something about it. So you got to say, hey, doctor, I need PT. I need to go see somebody. I'm tripping. I'm falling. Keep moving. The worst thing you could do is nothing, and by that I mean be stationary. When being static, not moving, is doing nothing to retrain any of these systems that need to be improved. So you just simply trying to walk a little. If you're not active, try to walk a little bit more. I don't care if it's in your house. Just get up and start moving around. Just the simple act of walking a little bit more is going to activate the muscles and the nerves to help you get better balance. Get your eyes checked. We talked about that. And look at the safety hazards, the potential safety hazards in your home. All right. Now, I want to stop because Brian gave me the thumbs up back there that it's time to stop and offer opportunity for some questions. Before I do that, what I want each of you to do today, because you're here, because you're interested in balance, right? We are going to offer everyone here the opportunity to schedule a complimentary 15-minute consultation with Amanda or Brian Califoot. Brian, come on up. I want everybody to see. Some of you probably recognize Brian. Brian is our physical therapist assistant here at the Concord office, but he actually started with us last year at the Hockessin office. So Brian works with Amanda every day. They are partners up here in the practice of treating our patients. Brian's also an exercise physiologist. So that immediately opens up a phenomenal amount of creativity. He's got more exercises in his head than I do, trust me. We're going to offer each of you the opportunity to set up a 15-minute consultation with Brian or Amanda on your balance problem. Remember I talked about, you think you have an infection, you call the doctor up, hey, send me an antibiotic, and how balance doesn't work that way? That's why we're doing this, because every one of you has a balance problem or an issue. It's going to be different than the person sitting next to you. So sitting down with Brian or Amanda, you can tell them exactly what your issues are, and they're going to walk you through a variety of little maneuvers like I just demonstrated, and that's going to help them help you figure out what's the next step. Should you be in here working out with us? Should you be seeing one of our personal trainers at one of the offices to have a more customized approach to exercise that you wouldn't necessarily have success with if you tried it on your own? Maybe your balance problem is such that you're not safe to exercise on your own and you need to have one of our trainers work with you. Or maybe you need formal PT. All right? Maybe we need to call your doctor and say, hey doc, I have so-and-so in front of me here. I've got some serious concerns. I think they need a little more testing done, and then we need to get them in PT. That's how we prevent you or someone you know from falling. Okay? This seminar is great, and I'm so grateful that you all came out, because I love talking about this, because I feel this is one of the most important jobs we have as therapists and therapist assistants, is to help prevent injuries. But it's not going to help unless you take some action, and part of that is you got to sit down in front of us, and we've got to help you figure out what you need. So, Kate and Desi are going to be up front before you leave to schedule appointments. Brian and Amanda have appointments set up, available for you to have these 15-minute consultations. One person, so everybody, from all the people who signs up, we're going to draw one name, and you'll win a free 60-minute massage here at the Concord Pike office. You all have a gift coupon in your folders for a discount for massage up here at the Concord office. But one of you who signs up for one of those visits can certainly win a 60-minute massage. Trust me, it's worth it. And Brian, and Amanda will walk you through whatever is necessary to get you better than you are now.